Greetings, namaste. Next up, we have the author of this year's chilling hit, Phantom Plague How Tuberculosis Shaped History, Vidya Krishnan, in conversation with Sri Ramkumar S. Vidya Krishnan and Sri Ramkumar, please take your seats. Vidya Krishnan is a global health reporter who works and lives in India. Her first book, Phantom Plague How Tuberculosis Shaped History, was published in February 2022 by Public Affairs. In 2021, she was awarded the Nieman Fellowship at Harvard University. Sri Ramkumar is the Additional Secretary in the Health and Family Welfare Department of the Government of Meghalaya. I now hand it over to you, Sri Ramkumar.
Thank you. Hello. Yeah. Thank you. After a very heated discussion, the last session, I hope we're trying to make healthcare as interesting as possible. But because this is a very interesting book and there is a very interesting history to how I ended up in this chair also. Let me introduce Ms. Vidya Krishnan. I'm very happy and it's a privilege to introduce you. She started her career as a journalist and the Pioneer, and then went on to freelancing for other magazines. She was also editor of health, editor for the health section for the Hindu. But now she is continuing to freelancing from Goa, a beautiful location to write from. And she went on to become the Nieman Fellow at the Harvard University. And she has a lot of accolades. And she continuously writes on the investigative journalism angle. But that does not thankfully, or I should say coincidentally, does not restrict only to health, even into the other matters also. I really like that about the article on the Rohingya crisis, which one happened. And it is again my privilege to introduce this book, Phantom Plague, because I was just telling Vidya also, and 2-3 months back we were in Kerala for studying Kerala health systems and etc. with my principal secretary, and we had some time at the airport. I was just telling the only airport in the entire country which has, I think I can say, much diverse books in a very decent manner is, I saw only in Kochi airport. And book immediately I picked up was The Phantom Plague. It was just, in fact, the person who was handling the bookshop, he introduced me to the book. I don't want to disappoint you, Vidya. It was not there on the, by the way I was choosing book on something, he introduced me to, why don't you read this book? It looks interesting. I said, then it looked interesting. Government of Meghalaya and NHM, National Health Mission, which I work, we are probably the largest buyer of this book. I was so enthused about the book. We bought 50 copies of this book. And we gave to a lot of our TV unit. In fact, I gave my book to my principal secretary, he read. I think I gave to another doctor, Dr. Saldana, so she's here. I gave it to her, she read. Or I think she had to borrow, I guess. And the book went on to Government of India's officials. They also read. Saturday I met them. So then Kong Mary asked me, can you do a session on health? And we are calling Vidya Krishnan. It was such a coincidence. I said, definitely I'll do the session. I'm so very happy to introduce this. Before we go more into the nature of your writing, Vidya, can you just briefly tell the readers or remind the readers how much TB was actually part of the life of our ancestors, or the previous generation, and how much it actually influenced the world? In fact, that was very fascinating for a person who has health as a background in terms of education, for me to start with. Can we start with that?
Yes, thank you for that question, but also for buying my book in bulk. I start the book with Dracula, which I wanted to claim as a public health story, because Dracula has been written a lot about how it reflects the sexually repressed Victorian society. But in truth, Dracula was also a book about blood infections, because around the time when it was written, it was considered that tuberculosis was hereditary, it ran in the families, and people did not know how infectious diseases spread, and the There is a very angry child. And it because TB is such an ancient disease, it gave me such a huge palette. And I usually write as a journalist, which gives me like 600 words or 700 words. And when I started writing the book, I really wanted to take it to all these places which I can't otherwise for a newspaper. And it was fascinating to be able to deep dive into how much of our world has been impacted by tuberculosis. So we check into hotels now and we get a clean soap and fresh linen because of anti-TB reformers. And it's a disease that teaches us so much about ourselves, and it has inspired so much literature and art and operatic tragedies. And I wanted to start with all of that because, again, TB is such a depressing topic to expect a reader to pick up the book, which is why you see the first section of the book is just jam-packed with pop culture. So there is Sherlock Holmes, and there is tuberculosis, there is Victorian fashion, how it impacted trailing skirts and female fashion senses and corsets. And I took my time diving before I got to all the depressing stuff, which there is ample of in the book.
That was very, very interesting, and it's even for the non-health professionals. It's a great read. I said right after reading the book, I said, we should have photographs of these four gentlemen in our office, Doctors Ignaz Semmelweis, Hermann Koch, Joseph Lester, and Louis Pasteur. We have a Pasteur Institute here in Meghalaya. It was 104-year-old institute. And amazing human beings who saw science and things objectively beyond their times and who were able to course correct and bring us. So, what makes you to choose a topic which is probably was very, very important a couple of centuries or a century, almost even a century ago, but most largely forgotten, I think, too. Why do you want to bring it back now? And what is that thing which inspired or continues, because writing a book needs a continuous inspiration. What did it continuous inspiration to keep this going?
I wrote this book, everything else in the book before chapter 7. I wrote the book to be able to tell the story of one particular teenager who died of TB. Her father was a government official. He spent his entire life working for the government of India. And then his daughter was diagnosed with TB, and the government of India fought him tooth and nail, and the health ministry refused to give him medicines which were available in India and were being made in India. And at that point, I was the health editor for The Hindu. And this teenage girl had gone to Delhi High Court to challenge, or she'd taken the government to court to access medicines which were available. And it was really shocking for me. I've covered health in India for 2 decades now, and we are the pharmacy of the world. With COVID, we now know that we made vaccines and we sent it to the rest of the world. So it was really shocking for me that we had medicines which we are making here in a factory in Nagpur, but it's not available to our people because we are shipping it to WHO or Geneva or all of these places which are in patent monopolies. And I could not reconcile how much the government, they almost dedicated exclusive resources to destroy this family, because the girl died, her family went back to Bihar, and the landlord evicted them because they didn't want someone with TB living in their house. And her younger sister was thrown out of school because the school did not want someone with an infectious disease. And all of this is when she did not even have the kind of TB that spreads in that way, and she was already dead by then. It was just, it will take me a very long time to forget this teenager's story. And I realized that I could not just spring it on a reader without taking them through this journey of how much crushing stigma TB patients have to deal with. We talk of TB as if there are 3 popular myths about TB. that it's a disease of one organ, it's curable, and it affects the poor. At this point, all three things are dangerously wrong. Pulmonary TB affects lungs, but TB is exactly like cancer. It can affect every organ in our body. It's definitely not affecting the poor. With COVID, we now know that infectious respiratory diseases, you can't escape them. No caste or class or gender bubble can save you from it. And increasingly with antibiotic resistance, which is again a huge problem. India is the largest consumer of antibiotics. Because of that, we also, not surprisingly, have the largest burden of drug-resistant tuberculosis. So in the book, I write about how Mumbai is where we are seeing the dawn of the post-antibiotic era. And none of it is a surprise. All of it is because of how Mumbai, as a city, is the slums of Mumbai are a petri dish. They're incubators for all kind of pathogens, but particularly TB. And all of these, I worked on this book for 7 years, and then the pandemic happened. And everything that I was writing about came to pass in the last 3 years. And I kind of feel like we are now at a point where, as tragic as the last 3 years have been, there is also hope, and there has never been so much attention on infectious respiratory diseases. And all of that is a chance to, have this conversation at literary festivals. I cannot think of a topic like this being showcased at a literary festival before the pandemic. So I do remain hopeful, but things are very grim, including in the Northeast, which is a high burden part of India. Sorry to lump all of Northeast, but all the states actually at this point do have a high burden.
That actually leads to my next question. In fact, that chapter on the inside the building number 10 in the book is such a alarming chapter, because I knew about the drug resistance TB in the initial days when I joined health. A couple of doctors from couple of hospitals from here were telling me this is going to be the, many places it is touted. I hope it is not like a pandemic of the future. I think even in the book it is kind of mentioned, because a person can go to hospital without anything and just can get infected with the drug resistant TB, and that, imagine what it will do to the health seeking behavior generally. It's a very dangerous situation. In fact, this is what kept mothers from delivering in hospitals in 18th, 19th century, where if you go to a hospital, the chances of you dying was very high because people were not washing off their hands, and that's how Semmelweis and etc. All this history is mentioned in this book. I think that's why it makes it even more compelling read. My question to continue on what you mentioned was, how do you think this pandemic has changed this narrative for public health in general? Or has it brought any new interest in public health? You're right, I have also not seen any health related topic in any. I've been to literature festivals in the last, I think 10, 12 years. I have not seen any, forget this thing and not which we seriously discussed. So what is that you think, not only in terms of general awareness and etc., but even in terms of seriousness, public policy level, have you seen any of these changes because of this pandemic?
It's
Sorry, what are the changes, if you're not seeing, what are the changes you'd like to see?
I feel one of the things that's happened with the pandemic, so there are good and bad changes. What happened, so when I was reporting the book, I started reading about plagues from the 5th century, which is the Justinian plague. And some of the things are so predictable. In India, what we did was blame the minorities for spreading an infectious disease, which is again like all of this is I was in the US at that point, and there was anti-Asian hate. So this xenophobia, and I feel like plagues historically bring out our basest, worst versions to the fore, and that's because someone afflicted with a pestilence is us, shorn of all the illusions. That's something that can happen to us. And what the pandemic has done with the reporting about infectious diseases is just there's more focus, but there's also more hysteria about it. There's no real. In India, what happened is most newsrooms don't exclusively dedicate resources to health, which is a very technical beat. So the minute the pandemic hit, we had all sorts of reporters jump on the beat who did not have an understanding of it. And all of that muddles the issue, so it becomes more political. And then it became like how the Muslims are spreading, much the way how typhus was spread by Jews in Germany. So all of that also happened, but I kind of want to focus on the positive here. What's happened because of the pandemic is there's just more masking, more acceptance to masking, more awareness, more tolerance to understanding that infectious diseases, we are all in this together. You know, this understanding of collective destiny, because no one is safe until everyone is. And I'm frankly, the TV program entirely was cannibalized by COVID. And I know in the health ministry, including the TV helpline was turned to COVID. And now we are kind of recovering from it, and I'm hoping, one of the things that I'm hoping is in the last 3 years, there's been so much investment in, I did not know people talk of RT-PCR as if they knew, as if they know what an antigen test is or what an RT-PCR is. But now we do have a higher awareness in people. And also within the ministry, there have been more investments in diagnostic tools, molecular testing. And I am now hoping that we will merge these programs, and now that we do have these diagnostic tools, we will use them not just to screen TB, but also make screening, not just for COVID, but make screening for TB easier. And I really do hope in the next few years there is room for conversation, which is just never. I remember reporting in the slums of Mumbai, in Govandi and in Chembur, and people with drug-resistant TB, the chapter that you mentioned, has this one building in the slums where 51 people in one building have drug-resistant TB. That would be equivalent to 51 patients in one building having a rare cancer. It's unthinkable in public health. It's terrifying that it's happening. It's terrifying that people are not talking about it. But now we are, and I hope that gives us room not to stigmatize TB patients and blame them for what's happened to them, because we've constructed urban cities in such a way that wherever lockdown did this the most, where TB patients were locked in with people, and then we had infectious diseases that were just boomeranging for the time being. Like for a limited time being, it boomerangs, but then it ricochets out. And I write in the book that Mumbai, the rich people went the only way they could, upwards. But then Mumbai's most famous resident, Amitabh Bachchan, was diagnosed with spinal TB when he was filming the first season of Kaun Banega Crorepati. No one is safe from this. And I really do, again, I'm so, one of the most joyous things from this has been that the health department has shown interest in the book. Because the book is not very complimentary. It's not very, it doesn't mince words. And yet I have met people in the health ministry who are open to listening to the stories from patients. And all of that does give me hope.
Thank you. We are not the Dracula because we are also here to listen and kind of find solutions, because that's a mandate for us to do. In fact, it might make you more happy. We had only 7 molecular diagnostic testing facility before the pandemic. Today we have 45 across the state. We have spread it out. Thanks to, again, because of this, thanks to additional resources. Every 20, 25, 30 kilometers in Meghalaya, anywhere you go, you can find a molecular testing, and we have increased it by 5-fold, actually, not 5-fold. In fact, today it is we used to do 70% microscope and 30% molecular. Now it is the other way around. 70% is molecular and 30%. So we catch them very early. In fact, last week we had 2 weeks back, we had a very serious discussion on this, but thank you. I'll just open the floor to questions because we have 10-15 minutes time. From behind, I can see a hand. I think I can't see who it is, but oh, doctor. Okay, you could not catch me in the office. We can't hear. Please go ahead. There is a microphone. Can someone pass the microphone to behind? Yeah.
Just wanted to tell you, Vidya, that the book was absolutely fantastic. I studied in JJ Hospital, so Robert Koch's institution where he first started the testing was in JJ Hospital, and the other second one after TB was the HIV, and that also, we because of Kamatipura being near JJ Hospital, we had a lot of cases originally, and the government was quite blind about it at that time too. I loved your book because it's very difficult to write with medical stuff which is easy. And the story of that girl was so touching. And really, it was really wonderful to read it. Probably I'd just ask you, what are you planning as your next book?
I'm not planning a next book just as yet. This one took 7 years. I want to get back to reporting. And thank you so much for this. As much as difficult as this book is, I will say that it's been received with so much love, especially from the medical community. And wherever I go, this comes up that it's so difficult to write about TB. And I will say that I'm not a student of medicine, and my craft is to tell a story, which is why all you see in the book is incidentally, TB is an incidental character which moves along, but the story is about people like Ignaz Semmelweis, or the rivalry between Pasteur and Koch, and or patients today. And it's I do feel if we told stories of health, not in like 20 lakh people have TB, instead of anonymizing diseases in that way, if we told stories of health by putting a face to the person instead of treating them like a disease, it would just be easier to make people to relate with these stories. And that was an attempt, and I'm glad it hit the mark.
Thank you. And just one thing was, for COVID, I was in Bangalore. I'm from Bangalore. And in COVID, there was college students, young people, old people who would collect at St. Joseph's University to repack bags of food and give it to slums and, tailors and workers who were abandoned, who had no work. So COVID also, I thought, brought out the best in humanity, not just the worst. Thanks.
In some humans.
One more question. Can we take one more? Can we give the lady a chance? Or we can quickly take two, no issues. Sorry, someone raised a hand first. Yeah.
Hi, ma'am. I teach history here, and I'm also actually pursuing my doctoral research in the history of medicine in colonial Assam as such. So my question is going to come from a little historical perspective. First, actually, I want to tell you that I have not read the book. So I want to actually know if you have anything ventured in the book. First, TB as a disease came up primarily as a tropical disease. So since the colonial period, we see that the idea of, like you mentioned, that a particular group leads to a disease become very prominent, and that was the scene in the colonial era as well. So there were the creation of black towns and white towns, segregation and all that. So in the case of tuberculosis as well, do we see anything of that business happening? And somewhere or the other, because I believe if we have to understand the history of colonial India, we can never understand it without understanding racism. It was embedded in the DNA of the history as such. So do you see somewhere the disease as such is also, the exclusion that comes along was motivated from racial perspective? That is one question. And the second one is, one thing that I have personally seen is that disease like these have a tremendous impact on the morphology of the cities and towns as such, because they kind of are excluded, you're far. So how, to what extent do you think tuberculosis as a disease also must have created seclusions or pockets of seclusions and defined how cities in colonial India or at present must have been kind of defined by it?
Do we want to take the second question? So I
Yeah, we
answer
can combine
together?
both, and
Yeah.
we can answer Shweta or something. Yeah.
Firstly, just a confession that I haven't read the book yet, but now that I'm here, I'm quite intrigued to read the book. Secondly, my question would be like coming back to what the author has said, that during the COVID and even during the TB reporting period, no, we did a lot of numbering of people. We would not take people on the as a stories, but we would assign numbers to them, like the first index COVID case, and how many cases have been reported today. Not the impact, but how many deaths, how many, so at one point of time, even we felt that humanity was being lost. And I was involved with the government in a lot of COVID reporting, where sometimes, every day things became very depressive. So I would also think of ways and means of how we could do reporting in a more storytelling format, because of which now this book is a point of interest for me. So my question is very simple. If someone would, how do you assign, storytelling in your, because it's a very serious issue, TB, COVID. So how do you merge the two and bring more of a humane aspect to this kind of very technical issues of reporting, which of course covers, a lot of,
Okay, thank you for that question. I'm going to take this one first and then come to you. I agree there's a lot of blame with newsrooms and how we train younger reporters to tell stories on health. And it took me a long time to learn that when you tell stories of health with data, it serves to anonymize the patient. And I've been guilty of that quite a bit, and I course corrected much later in my career. The thing with the narrative non-fiction, again, we are also, my basic, I'm not a student of medicine, my basic craft is to tell a story, and it's never easy. With this book, I don't go into as much data. I put them in annexure and I put it at the back, and I've centered it around people. It can be done. It can be done. It is done by good storytellers. You always need a narrative engine to take the reader along. With TB, it's such a tough ask on a reader to pick a book about TB, because it just can't be depressing information chapter after chapter, which is why you see the first 3 chapters are just literary nonfiction. Then there is Mumbai, where it's a story about a city and how that city was, that city came into being, how it was shaped by a bubonic plague. And there are ways to shape this, and which is why it takes 7 years to tell such a story. In a newsroom, you don't have that kind of space, which is also why I had to decide not to do it as a journalistic exercise. And I'm glad I took a step back, and this is a result of that. About your question about morphology, increasingly I do feel that it's impossible to talk about infectious diseases without talking about race, caste, gender, class, especially in a country as hyper unequal as our country. And we have a history of ghettoizing people with infectious diseases. India was the only country which had leper colonies. And we continue to do that. So if you have cancer, you will have friends who would be like, oh, can I come and hold your hand while you sit for chemo? But the minute you say, I have TB, I have friends who've had TB and they're like, dur khade hoke baat karo. And TB also has a very toxic chemotherapy. And the kind of, at its core, in this new world where we are all used to quarantines and lockdowns, the question here is not how pathogens spread and how we can keep ourselves safe from the pathogen. The principal question here is, will our decency, do we have a bedrock sense of decency to step up for the poor, the vulnerable, the sick, the old? And we with this book, I really do hope we force a conversation where we demand health as a right, which is a business between us and our government and not something that's outsourced to the private sector. And a lot of that is in the book. I do hope you pick it up and like what you read.
So thank you. Between Shah Rukh Khan and Northeastern matters, we're getting little squeezed in health. So there is a last 1 minute. I request one part of the book to be read. So I request Ms. Vidya to read one part.
It's a really, really small portion. This This is chapter 12, but it's the newsy portion which should encourage you to pick up the book. It's called, the chapter is called Phantom Plague and the Missing Millions. Here goes. The WHO estimates that 1/4 of the world's population has latent tuberculosis. The HIV epidemic was a rude awakening. Suddenly there was a realization that TB was a grave crisis. HIV, because it compromised immunity, liberated latent TB. The logic was inescapable. Any widespread epidemic that adversely affected immunity had the capacity to make latent TB into an active and deadly killer. And in Mumbai, TB is everywhere and nowhere. Spotting the bacteria is like spotting a tiger in a jungle. While glimpses are uncommon or fleeting, there are fresh prints that show a predator lurking by. You don't have to walk into a hospital to find TB. You see it in spit stains all over the city, in unprotected coughing and sneezing in crowded buses, in tightly packed ghettos. Today, India is a moist nation of spitters. The spread of TB is extensive, and it is extensively denied by the government of India. I will leave you at that.